Good afternoon. And today we have a pleasure to interview our first guest from Integrative Medicine, Dr. Natalia Fuksina. Good afternoon, Natalia.
Good afternoon. How are you today, Dr. Sakalina?
Yes, pleasure to see you. I'm gonna first say thank you very much to our audience. We appreciate every one of you. And if you have any questions about integrative medicine and what it is, we're gonna find out a lot of details about that. Please put your questions in the chat box. And if you're listening to us in a recording, you can get your questions to Dr. Fuksina by typing it in the comments, and we're gonna find you the answer. So if you have a trouble sleeping or sleep next to the snoring partner, please click the like and share button. This way you can spread the word about our channel to your friends and family. If you're medical profession and just like us, you're trying to find all the missing pieces about sleep and breathing disorders and find a solution for your patients or for your family members, how to treat those disorders, please use our channel as a networking ground. We would be very happy if you help us with our mission to connect medicine and dentistry together and find the answers how to treat obstructive sleep apnea or upper respiratory resistance syndrome or snoring and anything related to those conditions. And I'm going to tell you my story about why I invite Dr. Fuksina to our channel. First of all, it's my dear friend, and I highly respect her professional opinion, and I consult on a lot of topics with her. So I value her opinion a lot. Second, she is representative of integrative medicine. She's a primary care physician who really looking for root cause of a lot of disease what we come across, what I come across when I treat my patients with sleep apnea. They have a high blood pressure, weight gain, diabetes, problem with libido, with the sexual hormones, of course, weight gain, and a lot of in that area, a representation of it, high blood pressure, cardiovascular complication. So I want to understand why is that for me personally and for my practice. So my first question to you, doctor, please tell me, what's the difference between integrative medicine solution and regular primary care physician approach?
First of all, thank you for having me and thank you for an introduction. And it's really, I think, an extremely interesting topic that you're onto and very much needed because sleep apnea is common. Sleep disorders are very common. So we'll address that in a moment as we go along with our podcast. But first of all, so the traditional medicine is somebody who is a primary care doctor, board certified in internal medicine or family medicine. I am board certified in internal medicine. So that's a traditional training, right? Medical school, residency training, you pass your boards, you're out in the wilderness, and then you treat your patients. So there are definitely guidelines that we follow in traditional medicine. That's been years of research, treating patients with traditional means, testing, medications, a little bit of advice on lifestyle. In the integrative medicine, we try to employ all the other knowledge that has been accumulated over tens of years before us, or maybe even hundreds of years before us, delving into alternative practices that have been around for years and years, and maybe even centuries, which have not been studied maybe in traditional medicine as well. So we may use functional medicine approach. We may look at yoga. We may look at supplements. We may look at herbs, vitamins, exercise, relaxation techniques, even acupuncture is considered to be integrative medicine. So it means different things for different people. However, it encompasses other methods of healing, looking for root cause, looking for lifestyle changes, and adding natural supplements as much as possible to improve somebody's health.
Thank you. Thank you very much. And I want to bring again, very often among my patient population, we have that very, common picture, sleep apnea patients, it's overweight or obese male. And I want to bring your attention what Dr. Fuksina actually specialized in treating obesity for her patients. Like that's one of her niche in the practice. So that's my question. Besides, weight gain, which is true for a lot of sleep apnea patients, I notice that a lot of sleep apnea patients have high blood pressure, acid reflux, diabetes, in additional to obstructive sleep apnea. Tell me, what's metabolic syndrome and how you approach it? That bouquet or constellation, I like the word what you use, constellation of the.
Constellation, right? So it's almost it's not a disease by itself. I would say it's a phenomenon. It's a constellation of all the named, as you name them, manifestations of the syndrome, right? It's obesity, usually gaining weight around the waist in the middle. So we call it central obesity, increase in blood pressure, pre-hypertension or hypertension, increase in fasting glucose, increase in sugar, fasting glucose, increase in insulin. So that leads to prediabetes, diabetes, high insulin resistance, and obviously increase in cholesterol, specifically triglycerides. So this is a constellation of factors of metabolic syndrome, and it's very difficult to tackle in with one modality because it's not caused by just one problem. It's some genetic predisposition, more so manifesting in males, right? And then we have to tackle it differently. So we tackle it by addressing their weight, by addressing their sleep, by addressing what they eat, and trying to employ exercise. So, in integrative medicine, it's always looking at a person as a whole and trying to embrace how one eats, how one sleeps, and slowly but surely move in the direction of healing what needs to be healed and fixing what needs to be fixed.
No, it's a wonderful answer. So I'm going to ask you very specific. Can you lose the weight in the presence of sleep apnea, in the presence of all of that? Because a lot of people, or in a lot of doctors' office, they said, oh, just lose weight. Tell me how it work in a real life, because I see it. It's not so easy.
Well, it's $1 million question, right? It's absolutely not easy to lose weight in the presence of sleep apnea because sleep apnea is one of those major hurdles in losing weight. When somebody is not getting enough sleep, hundreds and hundred times during the night, they keep waking up, the brain is not resting, cortisol is through the roof, their growth hormone is down, their testosterone is down, they're tired, they're wired and tired often. They're going to want to eat more just to sustain themselves. People will crave sugar, people will crave high density food. So here's your answer. It's very, very difficult because it's against the grain. They're so tired, they want food, they're going to crave more. Okay. So the question is, can we absolutely resolve obesity by fixing their sleep? Well, this is difficult also. We can help them. We can definitely help them. And we know from studies by fixing obstructive sleep apnea, whether it's oral appliance or CPAP, we can definitely help them with weight loss. And the reverse is true. For every 10% weight gain, we have increase in sleep apnea by 30%.
Yeah.
So if we decrease sleep apnea by 30%, hopefully with appliance or CPAP, maybe we can increase their propensity to weight loss.
I look at that like a circle. It's a vicious
Definitely
circle,
circle.
and
Definitely circle.
only working together with the between sleep physician and whatever practitioners, usually the dentists who treat with the oral appliance, only working together, but they can really help the patient. No, but
Absolutely.
just like we can collaborate, I really encourage physicians to collaborate with dentists if patient doesn't want to use the CPAP, because a lot of them don't.
A
But
lot of a lot of them don't, and even if they do, or with with oral appliance, it still becomes more than just one modality.
well, more.
You always have to address their lifestyle, what they eat, what kind of food they're putting in their body, because after all, we are what we eat, right? And then try to get them moving. Some energy expenditure. Try to get them to physical exercise, build muscle, improve their stamina, improve their energy level, because they will be perpetually tired if their apnea is untreated.
Absolutely. So I'm going to ask you the question. A lot of patients come to me and they're already so tired. And I know, of course, for success of oral appliance therapy, they need to lose weight. But, I used to be very naive and I would talk to them. Oh, you need to do that, work on the nutrition. My number one question. If somebody have full of energy and really want to approach it, like I'm ready to go, what would be your modality? What exactly you look, what exactly you advise, how you build the building in a good circumstances. And after that, I want to ask you the question, if circumstances are not so good, if somebody is so tired they don't have a will. That's what I learned what a lot of sleep apnea patients, they don't have a will. And that was aha moment for me. When you just don't know somebody, then you don't understand. But seeing the patients over and over, you do the recommendation, nothing happened. Then I got my aha moment. No, it has to be different. I have to approach them totally different. So my first question to you, if we have a really stable building and we build, what's your recipe to approach somebody with metabolic syndrome? What are you looking for? What components you're looking for and how you approach them? Then we're going to talk about different situations.
Nothing is ideal, right? But if I had my magic wand, right? So I would love to approach each patient from several different angles, right? So we have somebody who has extra weight, whether they're in overweight category or they're obese. They have sleep apnea, most likely. Without even testing, we know that the risk of sleep apnea is very high once they're in the obesity category. So if I had my magic wand, I would address them on the several issues: nutrition, sleep, hormones, physical activity. Easier said than done, but this is how we begin to tackle, because nutrition is very important. It's all not one size fits all. Somebody likes plant-based diet, so giving them a keto diet would be very, very difficult, right? So we have to figure out somebody's cultural preferences, somebody's long-term goals, somebody who I can put on a nutrition plan and be successful with it, right, long term. So we have to address nutrition with keeping this person in mind. What are their preferences to eat? Should I put them on a keto diet? Should I put them on a low carb diet, paleo diet? Should I use medications to help them lose weight? Right? Even though we want to stay as natural as we can, but sometimes it's not sustainable. So sometimes I have to use medications to help them suppress appetite, cravings, address nighttime eating, binge eating, etc., etc. So we have to use medications when appropriate. Then we have to address their hormones. Are they in menopause? Should we fix menopause and help decrease their sleep apnea in conjunction with oral appliance or CPAP? Right? How can we fix their sleep without giving them a sleeping pill? That's a big question. And then try to get them moving, designing a physical activity program that's sustainable. Can we fit in maybe 10 minutes a day, 15 minutes a day? Because an hour a day is probably unrealistic to expect from somebody who is perpetually tired, has no energy, and has 8, 9, 10 hours that people typically spend at work and home responsibilities. So again, personalized nutrition advice, maybe natural supplements, maybe prescription medications, fixing their sleep, and getting them moving.
Yeah, thank you very much. It's a wonderful, wonderful, very clear explanation. And thank you very much to our listeners. We appreciate your comments. They make us encouraged to keep going with our topic. I think it's a great topic for a lot of people. So my question to you, a lot of people come to me, they don't have a will. I just mentioned about that. I talk about movement, and I know it's just useless for me to say. It's even upsetting to the patient, so I don't talk about that anymore. Tell me, is it possible to do something for the person who have no energy whatsoever? Depression play the role. Like, somebody come to me and I already know all my recommendations not gonna be followed. Tell me, what's the design for people like that? A lot of time, partner bring the patient. Somebody who love my patient, bring them, and they're concerned. They don't know what to do. They lost. The relationship start trembling. A lot of things. This building, what you just built, it's not so stable anymore. So what can be done for somebody like that?
I actually this is a very good topic, and thank you for bringing it up because it's actually very common. And I think that a lot of healthcare practitioners don't realize, and when they tell somebody, okay, just go exercise and lose some weight, how demeaning it is to a patient. Sometimes they can't, whether it's motivation, whether it's depression, and depression is a comorbidity that is associated with sleep apnea. We know that. It's also comorbidity associated with low testosterone, which is also low because of sleep apnea. So one thing leads to another. So recognizing that is extremely important. But I'm going to let you in on a little secret. And the secret is that it is very possible to lose weight without exercise. We can change dietary approach. We can change timing of feeding. We can change the type of food that we eat, still feel satisfied. We can use natural supplements. We can use prescription medications. We can even use the injections that everyone's talking about, something like Ozempic, Mounjaro, etc., to help lose weight. And it is all possible and doable without exercise. Once somebody loses weight, it is advisable to start exercise when they can, when they're able, to help sustain the good result, to keep that negative energy balance, right? To expand maybe extra 200, 300, 400 calories in a day to sustain and maintain. But to lose the weight, you can do successfully without exercising.
I think it's very hopeful. It's really hopeful just to know, like, you would do certain things, what you can do, and your effort would be rewarded. I think that's already create a positive mood and
Absolutely.
desire to move forward. But I want to say that then your practitioner, your medical doctor or dentist understand you, understand what's inside. I think it's very important. The compassion and understanding, really two keys for success in our field. But that's my opinion.
No,
And
you have to
I think
listen.
you have it, you understand the patient concern instead of just with the directions what going nowhere.
Absolutely. You have to listen to your patient. You really have to give a little bit of your own soul to a patient in front of you to help them. You really need to listen and understand them, where they're coming from, what the limitations are, right? It could be limitations to exercise, maybe limitations to using CPAP. That's all. I hear this all the time. Said, doctor, it's been sitting collecting dust for months.
I hear it all the time. So my question to you, very intimate question, what I get very, very often. And again, we appreciate all our listeners. I hope we can answer that question. Dr. Fuksina can answer the question what I get asked a lot. It's very intimate. A lot of male patients complain. And now I have a question from our listeners. Actually, I have low testosterone and taking a supplement. That's they're
Okay.
talking
So
about
low
narrow
testosterone,
nasal
right?
cavities, but my question was a little bit different, but it's related to my question in a way how I'm gonna question. No, first question is why it happened. What a lot of patients have low testosterone with the sleep apnea.
Okay, yes, that's a known association, right? So what happens is, first of all, sleep apnea is more common in males, right? And testosterone levels will go down with age. That's just an accepted age-related phenomenon. Testosterone levels will go down no matter how high they were in their 20s, 30s, or 40s. And with sleep apnea, there is an observed further decrease in testosterone levels. And that has to do with just our complicated chemistry. So when somebody sleeps with obstructive sleep apnea, right, and their brain is constantly irritated by having to wake up hundreds and hundred times at night, it's all centrally regulated. The hormones are not produced properly, so the testosterone is down, the growth hormone is down, cortisol is up. So this is all is a comorbidity of obstructive sleep apnea, being overweight, having obesity, having extra weight around the middle, around the waistline. So testosterones are down, and fixing sleep apnea has been shown to improve testosterone levels. I have not seen in my particular practice fixing sleep apnea will completely resolve it, but fixing the sleep will help produce hormones, improve testosterone, will help on the weight loss journey. So, weight loss alone will improve testosterone to some degree. Sleep apnea fix with appliance or a device will improve testosterone to some degree, and the rest we can do with supplementation, with supplementing with testosterone.
And I want to ask you, we had that conversation before the live about natural supplement. And we talk about one wonderful natural supplement, which I always mention to my patients. And it's actually very critical component of Viagra. So I
Absolutely.
want nitric oxide. I want you to talk about nitric oxide and your approach towards that. And I love the question what our listeners ask about, low testosterone. And I did the X-ray done, and I show what is a very narrow nasal cavities, which make breathing through the nose very difficult. And from my knowledge and research, what I follow, a lot of nitric oxide get released in the nose and in the sinuses and turbinates. I know you have a little bit different view on nitric oxide, so we want to know your view and how you approach nitric oxide for why it's important and how you find it.
So, nitric oxide is actually a magical substance that we produce in our body naturally. As Dr. Sokolina mentions, it is produced in the nasal passages and cavities, but we also produce it naturally on the inside of the arteries. And it's been discovered fairly recently, maybe 20 some years ago. And an interesting story is when I was a medical student, there were professors who were working in a research lab, and we just looked at them as, well, they're just professors working in the research lab. Fast forward to 3 years later, they won Nobel
Nobel
Prize for
Prize.
discovery of nitric oxide. So I was 10 feet away from them at that point. It's just a little caveat.
Louis
Um,
Ignatius, yes.
so nitric oxide is extremely important because it is implicated in the health of the entire body. It's a magical substance that helps maintain health of the arteries, and arteries are obviously occupying all of our body from inside, and it's important to help them healthy and dilated. It's nitric oxide is intricately related to cardiovascular health. And because sleep apnea is intricately related to cardiovascular health, it becomes relevant in your practice because you practice, your niche in dentistry is fixing sleep apnea and all sleep related disorders. So supplementing with nitric oxide is actually very easy. It is considered to be just a supplement, not a prescription item. It can be found in various stores without a prescription. And it took some doing for them to package nitric oxide, which is actually gas, to package it into a little dissolvable tablet that you can place under your tongue and will dissolve and produce the nitric oxide in your body. But it's not long term, so you have to keep supplementing, and it will help even reduce blood pressure. It will help reduce cardiovascular risks, and it's been even implicated in helping reduce risk of cancer. So it's an incredible substance. I do use it a lot. I do recommend for patients to get it over the counter, but you can also become a little factory of your own and produce it by yourself on regular daily basis. So if you would like to comment on that, you can please comment and explain to the listeners how they can produce their own nitric oxide.
Yeah, we talk about it a lot. Almost in every episode we talk about releasing nitric oxide. I recommend this tool called Relaxator, and we actually interview the inventor of this little whistle, what you can get, I would say, stimulation of the air passing through your nose and through your nasal cavities, and have a not inspiration but exhale on a resistance and produce more nitric oxide in the nose. And humming, actually, it's a great tool as well. By producing a little music in the shower, you can help with nitric oxide. But in general, what I recommend, or what I pray to my patient, preach to my patients every day, but breathing through the nose, that's your tool. Don't open your mouth ever. Keep it closed. Just use your nose. Nose is for breathing, mouth is for eating. That's a common fact. Nobody knows. Nobody knows how they breathe.
Well, it
I see.
actually, yeah, probably is rooted in ancient Indian practices of breathing through the nose with different, assuming different asanas, different poses, stemming from practices from India. And those are ancient, and we know there are different um, breathing exercises that people do that help improve their weight, sleep, state of being, even be used as a treatment for anxiety because it relaxes a person. It has this parasympathetic calming effect on their nerves, right? And sets them for a great and energetic day ahead. So that's wonderful. There's so many people um, out there who do not realize that using those integrative, we're closing the circuit here, right?
Circle, yeah.
Integrative strategies with breathing, with the device that you just demonstrated. Some people are actually using tapes around their mouth. I'm not sure
Yeah.
I like that, but they do to encourage someone to breathe through the nose, right? To use natural supplements like nitric oxide, to use our knowledge of hormones, how to fix hormones, right? To improve one's health, to use our knowledge of nutrition, how to embark on weight loss journey that will be sustainable in the long run, and all in the quest of better health, right? And sustainable health.
I really like our conversation. I think it can be useful for a lot of people, this integrative approach to health. But it's not different department. You go to cardiologist, you go to endocrinologist, you go to the dentist. They all swim or dance their own dance. It's actually one picture. And, I think it's our goal as a comprehensive medical dental practitioners to explain to the patient what things cannot be, they're not separate, they all interlocked. for their own
Absolutely.
health. And I like what you're talking about lifestyle and nutrition. And I know I want to feature your podcast. People can just listen to your podcast on YouTube and get the knowledge. And I personally visit your Facebook page, and I got a lot of good recipes what people can use for breakfast, lunch, and dinner on a different ways. Of course, you have to find out what you're sensitive towards, what diet integrative medicine doctor recommend, but then you can use Dr. Fuksina ideas and put them in reality and enjoy delicious food. So thank you very much. We really appreciate it.
My pleasure. My pleasure. Thank you for interviewing and thank you for doing a good job in
Mhm.
spreading the word. It's very much needed.
Thank you.